Dear students, good morning to all. Today let us learn another remedy, another short remedy named TRILLIUM pendulum. It is a remedy given for control bleeding or hemorrhage. So this is the flowers of TRILLIUM pendulum, white in color, because the common name is known as white beetroot or white robin. Two names are there, and it belongs to family Smilaceae, and the brewer is Minton, and it is a remedy for controlling hemorrhages. Hemorrhages from any part of any orifice of the body, like nose, lungs, kidneys, uterus, or from anywhere, from teeth or gums, any part of the body. In order to control or arrest hemorrhage, we can give TRILLIUM pendulum. And the character of the blood, that is very important, that is profuse, bright red in nature, active or passive, with tendency to putrefy. So these are the points you have to remember. The bleeding nature of the TRILLIUM pendulum, it is profuse in character and bright red in nature, active or passive, and with a early tendency to decompose. So that offensive order is prominent, so there is tendency to putrefy. So let's apply these character symptoms upon generals, regionals, that is first upon nose. So it is a remedy that can be given to bleeding through nose, that is epistaxis. Then you know the character of the blood, that is profuse in nature, passive or active, bright red is very important. Then next, mouth, it can be given for bleeding through teeth, that is especially bleeding from tooth cavity after extraction of tooth. And the nature of the blood, that is profuse or bright red in nature. And also again bleeding from gums or spongy gums, it can be given. The nature of the blood is again bright red, profuse, active or passive in nature. Then coming to the respiratory symptoms, it is a remedy for spitting of the blood, that is hemoptysis, cough with the spitting of the blood. This hemoptysis is also seen in incipient phthisis. Phthisis means tuberculosis. With blood disputa, even in advanced stages of phthisis, with copious purulent expectoration, with troublesome cough. So respiratory system, it can be given for hemoptysis, and the character of the blood also you have to remember. That is in different conditions like phthisis, etc. It can be given even in the advanced stages. Then coming into the GIT, remedy for vomiting of blood, that is hematemesis, and also for diarrhea and dysentery, where in these conditions you have to remember the nature of the blood itself, that is blood bright red in nature, pure blood or bright red in nature, sometimes mixed with the blood, or sometimes even the pure blood is seen as in case of dysentery, diarrhea, etc. That is bright red in nature, profuse, active or passive. Then coming to the female symptom, this is very important, and the question usually asks the female symptoms of TRILLIUM pendulum is asked during your exams. So study well the female symptoms of TRILLIUM pendulum. So it first about the menses. The character of the menses is profuse, every 2 weeks, lasting a week or longer, after overexertion or too long ride. So you have to compare this TRILLIUM with so many other remedies that are used to control hemorrhages. Here the bleeding nature is very much profuse. This profuse character of bleeding you have learned in so many drugs. Calcarea carb, Calcarea fus, Ferromet, Creosote, Madornum, Murex, Thlapsy, Belladonna, Bovista, China, Natramur, Phosphorus, etc. This profuse character is very much marked. While the other nature, that is a scanty nature of blood, is noticeable in Graphitis, Pulsatilla, Lachesis, Causticum, Melilotus, etc. Here the nature of bleeding is very much profuse, that is every 2 weeks and lasting a week or longer, and is aggravated by overexertion or too long a ride. Under remedy, you have studied that even the slightest mental exertion causes profuse return of menstrual flow. Can you remember which is that remedy? That is Calcarea carb. Profuse mental exertion causes Slightest mental exertion causes profuse return of the menses in case of Kalkiriaka. Here, physical exertion അല്ലെങ്കിൽ ഒരു long ride cause the return of menses. Next point, very very important, this menses, that is flooding, that much profuseness is the characteristic. Flooding nature with fainting. Flooding with fainting is the peculiar nature of flow of menses in case of TRILLIUM pendulum. Flooding with fainting. Then regarding menorrhagia, the flow is profuse, again gushing, again bright red, and is aggravated by slightest movement. Already said in case of menses too. Then again given for hemorrhage from fibroids, from displaced uterus, or from threatened abortion or postpartum hemorrhages. Different may be the causes, but you have to remember the characteristic point, and that is that much flooding, that much profuseness is the characteristic, and is associated with fainting, and bright nature of blood is the characteristic. But there is one exception, that is in climacteric, the blood is dark clotted. Only the climacteric period of blood is dark clotted as seen in thalapsy ustilago, and the bleeding is in every 2 weeks. Other bleeding are always in bright red, has bright red nature, and it is also given for varices of pregnancy. Then there is another sensation during this bleeding, that is sensation as if hip and small of the back were falling into pieces. Similar sensation you have studied in some another remedy, that is head and body feel scattered in bed and tosses about to get the pieces together. That sensation you have learned in which remedy and in which condition? That is during the fever, delirium. Baptisia patient tosses in bed in order to bring back the pieces together, because the baptisia patient is too much delirious and had a sensation of the scattered body as if scattered, and he tosses in bed to put the pieces together. Here during the bleeding phase, the TRILLIUM patient has a sensation as if the hip and the small of the back were falling to pieces, and as if the sacroiliac synchrondosis were falling apart and wants to bound them tightly, as if the bones of the pelvis were broken with hemorrhages. So here the patient gets amelioration or gets comfort only after keeping the parts tightly, keeping the hip tightly. And also the patient is, due to the heavy flooding of blood, the patient looks pale, patient is very much anemic, faint, dim sight, palpitation, obstruction and noises in ears. These are all the signs of anemia. Then painful sinking at pit of stomach. These all symptoms associated with the bleeding. Then about leukorrhea. Leukorrhea is again copious, yellow, stringy. Regarding lochia, long lasting, suddenly becomes sanguineous. That is tendency to of redness is marked even in the lochia discharge. Again there is dribbling of urine after labor. So these are the female symptoms of TRILLIUM pendulum. Remember about the menses, nature of the blood, flooding with finding, don't forget it. Then menorrhagia, again the same symptoms. Hemorrhage from different conditions, it can be given, like from fibroid, displaced uterus, abortion, postpartum hemorrhages. But in case of the climacteric, you should remember that the bleeding has a dark clotted nature. Again it can be given for varices of pregnancy. Then the peculiar sensation of TRILLIUM, that is the patient chooses to bound the hip together because he feels that the hip is falling into pieces, or the sacroiliac synchrondosis way of falling apart, so want to bound them tightly. And due to the flooding of blood, the patient becomes anemic, so there is patient looks pale, faint, dim-sighted, palpitation is there, obstruction noise in the ear is there, and there is also painful sinking at the pit of stomach. Then leukorrhea, lochia, and dribbling of urine after labor. These are the symptoms of TRILLIUM pendulum, female symptoms. Then coming to the modality, aggravation, overexertion, too long ride, least motion, sitting erect, and the patient is ameliorated by bending forward and tight bandage. So these are all about trillium pendulum. And next we have to compare. The comparison part is very, very important. So in case of trillium pendulum, there is profuse bleeding. So profuse character of blood is noticeable in calcarea fos, calcarea carp, belladonna, bovista, ferromet, creosote, madorina, murex, natramur, phosphorus, platina, rustox, sabina, etc. etc. While the opposite condition, that is scanty menses or scanty bleeding, is noticeable in causticum, graphitis, pulsatilla, lachesis, melilotus. In case of causticum, the bleeding is very, very feeble. While the bright red, here the natural blood is bright red, except in case of bleeding from during climacteric period. All the blood is otherwise bright red in nature. So other remedies having the bright red nature are aconite, ipecac, lacananum, millefolium, phosphorus. Millefolium, that is painless fluid blood is noticeable. Then dark blood, red blood is noticeable in anthracinum. All acids, all Ophidia group, all are again dark, having dark red. So other remedies are anthracinum, hamamelis, creosote, crocus, macar, medorinum, secalicore, thlapsi. Thlapsi bursa pastoris having dark blood. Then tendency to putrefy or decompose or leading to offensiveness. Such character of blood is seen in anthracinum. Then Arsalb again the natural blood is scanty or dark in color, again nalla offensive ആയിരിക്കും. So anthracinum of baptisia again one of the triophor offensiveness. The other remedies are creosote and mersol. These are the trios for offensiveness, that is baptisia, creosote and mersol. So here the putrefying tendency is seen in baptisia, carbovagit, lachesis, mercurius, sorinum, pyrogen, sulfur, etc. Then epistaxis, it can this remedy, that is trillium pendulum, can be given for bleeding through nose or epistaxis. But here the nature of the blood is bright red, profuse, active, passive. Other remedies having epistaxis is carbovagit. Carbovagit is also known as corpse reviver. Then phosphorus having bright red and bright non-coagulable blood is in case of phosphorus. Then another remedy for epistaxis, hamamelis. Again for bleeding gums also there are so many remedies like carbovagit, lachesis, mercurius, nitric acid, phosphorus, sulfur, etc. and also for spongy gums. So these are the remedies to compare. Again we can compare the thlapsi menses with so many other drugs. First point, feels better during menses. Generally like actia, racemosa, etc. the complaint get worsens during menses. By some remedies have feels better during menses. In case of singamet, lachesis, macphos, etc. feels better during menses. Then what about the nature of menses of thlapsi? Thlapsis menses is dark blood, clotted nature, and menses is too early, too profuse and protracted nature. Protracted means starting, stopping, again and again, repeating. That is protracted nature. Variya nikka anganathe nature ulladana protracted. Then what about the bleeding of melilotus? In melilotus, menses is scanty and intermits. And melilotus is a remedy for congestion, and the congestion is ameliorated by hemorrhage. For example, if the melilotus patient has headache, this headache is ameliorated by epistaxis. So congestion ameliorated by headache, that is the important point of melilotus. And the menses is scanty and intermittent. Then what about millefolium? Millefolium is a remedy for painless, fluid, bright red blood. Painless, fluid, bright red blood, and the menses is too early, too profuse, protracted nature. And what about the Leukorrhea instead of menses. You all again learned some remedies. There is leukorrhea instead of menses. That is seen in Nas mosquita and cocculus. Again, what is about the menses of sulfur? Sulfur, too early, too profuse, protracted, and is a remedy for menorrhagia. And the patient says that not well since last miscarriages. That is noticeable in sulfur. Then regarding graphitis, the menses is too scanty, pale, late, with colic, irregular, delayed from getting feet wet. Delayed from getting feet wet, that is menses delayed from getting feet wet, is seen in pulsatilla also. In case of graphitis, the menses is pale, late. That is to be remembered. Then regarding creosote also too early, too profuse, protracted, flow more on lying down. Flows only on lying down or at night is again seen in MAC carb, ammonium carb, etc. Here creosote also flow more on lying down. And another peculiar feature is that here the cold drink ameliorates menses pain. In case of creosote, the dysmenorrhea got ameliorated by drinking cold drinks. Next about lacananum. Lacananum menses too early, too profuse, in gushes, bright red, and this thing is bright red and is very stringy. And you compare this with crocus. Crocus is similar but have dark blood. So in lacananum, bright red in nature, stringy. In crocus, dark red in nature and also viscid. While in case of lacananum, there is another important symptom associated with during menses is that the breast feels swollen, painful before and during menses. Then coming to MAC carb, menses preceded by sore throat. This symptom is again seen in lacananum. So menses preceded by a sore throat and flow more at night. And the nature of blood is dark pitch-like. That is similar to Madornum. Dark pitch-like blood. That is similar to Madornum. Next, Madornum. Madornum mainly complains at climacteric period. Profuse for weeks, dark, clotted, offensive, gushes on moving, and again this bleeding is associated with the malignant conditions of uterus. Then about Naxomica menses, too early, too profuse, too long lasting, then irregular, never at right time. Never at right time. Pulsatilla menses, late, scanty, more during daytime. And in sepia, irregular menses, nearly every form are noted. So these are all about important comparison of menses of other remedies. So go through all the slides, and if you feel any doubts, contact me or WhatsApp me. Thank you.